September 30th, 2009 was a tragic day for the family of Sharon Davis. She lost her husband of 42 years to a car accident. He was a dynamic man who touched his entire community through his history of church ministry. She had a great relationship with her husband. 11 months later, her 43-year-old daughter died. 17 months later, her young granddaughter suddenly ran away from home. Good morning, ladies and gentlemen. My name is Arslan, and along with my colleagues Rahi, Rina, and Avisha, we will be presenting the LOSS Initiative, which stands for Losing Others Seeking Support. Sharon sought out professional support. She was diagnosed with Takotsubo cardiomyopathy, which is commonly referred to as broken heart syndrome. Her symptoms were fatigue and lack of motivation. These are common mental health issues that one deals with, which makes this very scary. Unfortunately, mental health issues are highly stigmatized in society. Takotsubo cardiomyopathy is an emotionally induced disorder. It is a temporary heart condition that is developed in response to an intense emotional or physical experience. It is also known as stress-induced cardiomyopathy. The heart's chamber looks similar to a takotsubo pot, which is a Japanese fishing pot used to catch octopus. A common trigger of Takotsubo cardiomyopathy is the loss of a loved one, specifically due to a sudden loss, such as sudden cardiac death. This can lead to a weakening in the left ventricle. 85 to 90% of people affected by Takotsubo cardiomyopathy are women aged between 65 to 70 years old. This specifically affects the Hispanic and African American community at a high rate. My fellow group member Rahi will now talk about the mental health stigma and also about a survey explaining the commonness of these mental health issues.
Thank you, Arslan. Mental health is very prevalent in society. A conducted baseline survey regarding one's mental health in the past 6 months revealed that 65.6% of participants answered sometimes when asked whether they felt depressed, anxious, or scared. This sometimes right in between always and never. It can easily turn into always if no attention is brought. But due to this underlying stigma about mental health, many people are not seeking help. They're scared. Family, friends, loved ones, acquaintances will turn them away if their problems are shared. Mind over matter. It's all about stress and anxiety. People can lose years off their lives due to mental health undermining their physical health. This leaves them vulnerable to diseases like cancer, sudden cardiac arrest, and other health conditions. Mental health is the biggest unaddressed problem of our century, so it must be at the top of our agenda because 8 out of 10 primary care physicians state that they need more training in mental health than they currently have. This training needs to be implemented soon as, due to the COVID-19 pandemic, mental health statistics have grown. Many more people struggle with their mental health than ever before. Only 33% of the people struggling with mental health actually get the help they need. The other 67% are left to deal with it alone, leaving them very vulnerable. It increases the rates of homelessness, higher rates of incarceration, and unemployment. There are many negative factors that can contribute to one's mental health, such as losing a loved one, losing a job, getting fired, getting kicked out of the house, and other factors such as this negatively impact one's self-worth, feelings of self-esteem, and cause delays in treatment. Unfortunately, many physicians are unaware of the connection between mental and physical health. My colleague Rina will further explain.
Thank you, Rahi. As previously mentioned, many healthcare professionals are unaware of the connection between mental health and cardiac health. 3 main mental health conditions that can result from heart disease include mood disorders, post-traumatic stress disorder, and chronic stress. Individuals with severe mental illness have an average mortality rate 2 to 3 times higher than healthy individuals. 3 main demographics that can be severely affected by these conditions include women, veterans or individuals who previously have had PTSD, and racial and ethnic minorities, which include Hispanic and African American populations. These populations are at higher risk for conditions such as hypertension, high cholesterol, diabetes, and obesity. As shown here, the risk of mental health disorders increases by 2 times at age 30 and up to 5 times by age 50. Therefore, it is crucial that healthcare professionals are aware of these statistics because 50% of mental health disorders begin before the age of 14, and this number increases to 75% by age 24. If these statistics are addressed at an early age, overall, we will be able to lower the amount of mental health-related deaths in our society today. There are many linked disorders that can occur after the loss of a loved one. For example, complicated grief disorder occurs when an individual is unable to cope with the loss of a loved one, and as a result, is forced to adjust to a new way of life. 15 to 20% of individuals who experience loss are affected by this disorder. In addition, complicated grief disorder can result alongside many other mental health disorders, such as anxiety and depression. In severe cases, complicated grief disorder can result alongside serious cardiac conditions, which include coronary artery disease and even heart failure. Another condition that can occur after the loss of a loved one is PTSD, which stands for post-traumatic stress disorder. This occurs after a traumatic event in one's life where they experience anxiety and flashbacks around certain situations. Overall, 7 out of 10 individuals who have lost a loved one experience serious mental health conditions. Lastly, I would like to describe the great gender disparity in these cardiac conditions, especially in coronary artery disease, which can result after loss. Generally, cardiovascular disease is the leading cause of death in women over the age of 65. Many individuals are under the impression that women are being tested for these conditions, yet women are tested at a later stage in the disease, therefore leading to fewer treatment options for them. As a result, it is crucial that healthcare professionals are aware of this, and ultimately we are able to have more treatment options for women. Therefore, in our project as a whole, it is very important that we are able to make the biggest difference among the female population. Now I'll be passing it on to Avisha, who will be discussing support solutions.
Thank you, Rina. As Rahi mentioned before, we decided to carry out a field study in which we tested our population about how much they know about cardiac health. One of our main questions that we focused on was that how much does our community know about the correlation between cardiac health and mental health? And as you can see on this diagram over here, over 75% of people know little to nothing about the correlation. We did this survey anonymous, so we don't know their race, gender, ethnicity, education level, and most importantly, their opportunity. So we know that 15% of people know nothing about the correlation. And to bridge this gap, we created an app, CARE, Comprehensive Awareness Regarding Emotional Health. And our main goal of the app is to bring awareness to mental health in our community and also break the stigmas about mental health. Here is our app, and this is our baseline organization of the app that we'd like to further develop. On the first page is our welcome package, and where we let providers and patients log in. We also have a national resources button so that even without logging in, you're able to get to these resources that are sorted out from the best resources for immediate care and further care. Our next page is our wellness checkup, and here patients can put in their symptoms every day. And if they're at high risk, the National Resources button will pop up again. There, all this information will go to the providers. Additionally, we would like to use this wellness checkup to create a database, so we collect data based on location for further mental health research. Our next page is our weekly newsletter page. Here, each week a newsletter is proposed to our users. One of our main goals is to educate our community. So with these newsletters, we would like to bring in new statistics and facts about mental health. And on the bottom is a care package raffle in which users can win this box over here. And this box has many different items and it correlates based on your age. So for adults, we'll have a different box, and for children, we have a different box. And this box goes hand in hand with our activity calendar. Each week in the month, we have different activities based on the stuff in our box. We want to engage our users, so each week we have different activities. Finally, on the last page is our provider's portfolio. Here, all the provider's patients will be listed from high risk to low risk. Our main goal from this app is to bring it to other schools, organizations, and even hospitals. If a patient is sitting in the waiting room, they will be able to create a open conversation with their provider by filling out the wellness checkup sheet and also getting the national resources so when they do walk into their appointment, they can have an open conversation with guiding questions. Additionally, now school students have their own iPad. If we can implement this app every single day, the school providers will know about how students are doing mentally, but also to break stigmas about mental health early on so that we can prevent cases like Sharon Davis, a woman who lost her granddaughter, her daughter, her husband, and her mental health. At SCARF, loss is just one aspect, but it's the care and support you get after that really matters. Thank you.